in Barbara Kieslinger. Interestingly enough, we have had conversations with members of her community called Careables.org, specifically about how to bring different type of stakeholders into a collaboration context, into open innovation. Because Careables is an EC-funded project on open healthcare, which facilitates co-design, making and sharing of open personalized healthcare for everyone. They have a great portfolio of dozens and dozens of projects that they've co-created with medical experts. It's a fantastic website. I'm very happy to have you here, Barbara. Over to you.
Thank you very much, Christina. Thanks everyone for the invitation. I will also share my screen now, so I hope that you can you see it now? And I will go to, oops, doesn't work so good for me. Let me see. Yeah, share. Oh, I can share. I hope you can see it now, right? Can you just say?
Yes,
yeah?
we can.
Oh, okay, perfect. So yes, thanks again for the invitation. I'm speaking here in the name of Careables, but Careables, actually there are people who would be much more into speaking here than me, because I am coordinating, so to say, from a European project perspective, the whole group. But it's so much more, we started as a European funded project over 2 years ago. And so we had the opportunity for 2 years to prepare for this, let's say, because we committed from the beginning to co-design and making of open personalized healthcare. So DIY healthcare was just starting, and people were taking initiatives, and we wanted to give that more of a forum and a platform for sharing and activities around it. So this is how we all started, and we're still a project, but we are much more. So we understand ourselves now as a community that has grown since then, and we have grown globally actually. And I can, talk about more examples then, but especially with our partner, the GIG, the Global Innovation Gathering, who is actually a network of maker spaces, especially in the global south, or also individuals. They have been super active in contributing and taking on the Careables idea and sharing their designs also before. So as I said, we were doing this making personalized open healthcare, and it had already, the platform had already over 100 designs on it when COVID came along. And so we said, for COVID, of course, this is also the time where we have to provide the community with our support. And so what we did is, on the one hand, we shared stories from people who were active in our community, like our Brazilian partners in Olinda. They've been working with healthcare providers also before, so they already had connections. They were taking up designs from people who shared designs on our platform, for example, from Berlin, like the face shield. And then they took it up and they modified it, and they shared their experience again on our platform. And this is just one example. There were so many others as well. So we also shared their personal stories on our platform. We shared resources. Resources was very important for us also, because we felt that what is important is a kind of a trusted space. So people who take on designs from others where they know that this is already a trusted peer, a safe space. So I can try something out, and I can also say if it fails. So also admitting during the making or so what works and what doesn't work was for our community very important, and feeling that they already are in contact with people where it's okay, to say what works and what doesn't work. And from that also somehow some of the handbooks came out, or we have, for example, a legal department involved from the very beginning in our project, and they were very helpful in providing specific legal advice also. What changes now, how far can open healthcare be made now in these maker spaces, and what are legal implications, for example. That varies, of course, across countries a lot, but still they were able to give some basic advice, and actually they are being asked now quite a lot, so they're also very busy at the moment giving the legal advice on that. And then, of course, one of our core tools in Careables is our Wellnera platform, where we are collecting projects where people can document what they're doing. And we try to support people also in the documentation if they need any support there. At the moment, as I said, we have generally lots of projects out there related to open health and care, but we have also specifically 45 projects now on labeled with the COVID-19 tag. So where people provide solutions specifically for fighting COVID-19. And just a little bit also sharing our other activities that contributed to community building is, of course, the Careables global Slack channel and the Careables, the Geek Careables channel on WhatsApp. There has been so much going on in countries in the global south, and they're continuously exchanging their experiences. Same for our activities in terms of capacity building. We are taking up the topic of COVID there now, and actually I should say that unfortunately Enrico Bassi from Open Dot cannot be here because he's speaking at the same time at a similar event, the similar webinar. But for example, they have been together with the project, the DVMB project, coordinating summer schools where they teach co-design, design thinking, and digital fabrication. And in our case, always with the focus on health issues, health and care issues. Or the Academy, our team in Berlin, they work a lot with another organization, Match My Maker. So what I want to say here for community building, for us, it's very important that we have these established networks, that we work with other projects, with other initiatives. And another final example in terms of partnerships is in Italy, again, where since Enrico has been, and his team, they have been working for many years now, also with healthcare professionals, healthcare providers. So there was already an established, trusted relationship. And so we are also now as Careables working with the two platforms in Italy that provide COVID-19 support. So the Tech for Care and the Make in Italy, they're both platforms that are now connected to our app as well, to our platform as well, and exchange the designs. And again, just to stress here that for us, for our team, maybe I should also mention quickly the WAG team, they have been working a lot in the Netherlands, again, with care homes or with hospitals. So they've also had already the contact with the target group. And again, these established networks, trusted networks, was very important for us to, in these activities. So thanks a lot, and I'm happy to then talk more about it, but I tried to make it really short.
Thanks, Barbara.